Hi, everyone, this is the Encyclopedia channel. Why do we have strong desires and pleasures for some things, or feel depressed at certain times? This is actually triggered by dopamine. As a neurotransmitter, it regulates our physical and psychological functions. So what exactly is dopamine? How does it affect our human health? After watching this video, you will know the answer. Let's dig deeper into dopamine. Dopamine is a neurotransmitter also known as dopamine. It plays an important role in the human body and is involved in the regulation of several physiological and psychological functions. The structure and synthesis, function, and health-related issues of dopamine are the focus of our attention. The chemical structure of dopamine is CAH11NO2, which belongs to a simple aromatic amine. In the human body, the synthesis of dopamine is a complex process, mainly through several steps to complete. The first is the tyrosine hydroxylation process. Tyrosine is the precursor of dopamine. Through the action of tyrosine hydroxylase, tyrosine is converted into 3,4-dihydroxyphenylalanine, also known as L-DOPA, followed by L-DOPA decarboxylation process. In this step, L-DOPA is further converted into dopamine by the enzymatic action of L-DOPA decarboxylase. In addition, dopamine can be further converted into norepinephrine, which requires the participation of dopamine beta-hydroxylase. Dopamine beta-hydroxylase converts dopamine to norepinephrine, forming a norepinephrine precursor. The functions of dopamine are very extensive, involving many aspects of physiological and psychological processes. Let's take a look at the main functions of dopamine. 1 is emotion regulation. Dopamine plays an important role in the brain in regulating mood and affective states. Increased release of dopamine can cause feelings of pleasure, while decreased levels of dopamine can lead to low mood and depression. The second is motion control. Dopamine is involved in the regulation of motor control. It promotes muscle coordination and movement execution by affecting neuromuscular transmission. Degeneration of dopamine neurons can lead to some movement disorders such as Parkinson's disease. In addition, dopamine is also closely related to reward behavior. When we receive a reward or experience pleasure, the release of dopamine increases, making us feel satisfied and happy. This explains why we experience intense desire and pleasure for rewarding stimuli such as food, sex, social interactions, etc. In addition, dopamine plays an important role in cognitive function. It is closely related to learning, memory, attention, and executive function. An imbalance in dopamine may lead to cognitive deficits such as inattention, memory loss, and executive dysfunction. Next, we need to understand the relationship between dopamine and health problems. The first is mental disorders. Abnormal levels of dopamine have been linked to a variety of mental disorders. For example, schizophrenia is thought to be associated with overactive dopamine, while depression is associated with decreased dopamine levels. This is followed by addiction and substance abuse. Dopamine plays a key role in the reward system and is therefore closely related to addiction and substance abuse. Drugs of abuse, such as cocaine, amphetamine, etc., can increase the release of dopamine and produce a strong sense of reward. Long-term use may lead to the disorder of the dopamine system and the formation of addiction. Another class of health problems associated with dopamine is movement disorders. Parkinson's disease is a neurodegenerative disorder characterized by the degeneration of dopamine neurons, leading to symptoms such as motor dysfunction and tremors. In order to maintain the health and balance of the dopamine system, dopamine detoxification is sometimes required, that is, regulating dopamine levels in various ways to achieve the purpose of restoring normal function and relieving related symptoms. 1 is drug treatment. Doctors can use specific drugs to regulate dopamine levels according to the specific situation of patients. For example, antipsychotic drugs reduce the release and activity of dopamine, thereby reducing psychotic symptoms. In addition, some antidepressants and anti-anxiety drugs can also improve related symptoms by regulating the dopamine system. The second is psychotherapy. Psychotherapy plays an important supportive role in dopamine detoxification. Through cognitive behavioral therapy, psychological education, psychological counseling, and other methods, we help patients adjust their way of thinking and behavioral habits to promote the balance of the dopamine system. Psychotherapy can also help patients deal with the emotional and psychological distress of dopamine-related psychiatric disorders, addiction problems, or movement disorders, providing emotional support and coping strategies. Third, adjusting lifestyle is also an important aspect of dopamine detoxification. Here are some suggestions. The first is regular work and rest. Maintain a regular sleep schedule, including a regular bedtime and wake-up time. Getting enough sleep helps balance the nervous system and maintain stable dopamine levels. Followed by a healthy diet. Eat a balanced and nutritious diet, making sure you get enough protein, vitamins, and minerals. Protein is an important part of dopamine synthesis, and proper intake can help maintain the stability of dopamine levels. Moderate exercise is also an important factor. Moderate physical activity helps release dopamine in the body, which boosts mood and mood. Choose your favorite exercise method and stick to aerobic exercise and strength training to help promote the normal release and operation of dopamine. Also, stress management is key. Chronic stress and anxiety can negatively affect the dopamine system. Learning effective ways to cope with stress, such as deep breathing, meditation, and relaxation techniques, can help relieve stress and promote dopamine balance. Also, social interaction is important. Maintaining positive social connections and good relationships is critical to mental health. Communicating with friends and family, participating in social activities, and participating in meaningful group activities can increase the release of dopamine and enhance happiness and satisfaction. Finally, avoid drug and substance abuse. Abuse of drugs and substances, such as alcohol, nicotine, etc., can interfere with the normal function of the dopamine system, resulting in disturbances in dopamine levels. To avoid the abuse of these substances, maintain good health and balance of the dopamine system. It should be noted that dopamine detoxification is a complex process, and the specific methods and effects will vary with individual differences and disease types. If you or someone you know has a dopamine-related health problem, it is recommended to seek the advice and guidance of a professional physician. They can develop an individualized treatment plan based on your specific situation. In addition to the methods mentioned above, there are some other supplementary measures that may help detox dopamine. The first is to pay attention to diet. Several studies have shown that specific nutrients in certain foods can boost the synthesis and release of dopamine. For example, foods rich in tyrosine, such as milk, dairy products, nuts, and beans, can provide the raw material for dopamine synthesis. In addition, foods rich in tyrosine hydroxylase, such as bananas, cherries, and watermelon, can also promote dopamine synthesis. The second is to pay attention to mental health. The maintenance of mental health is critical to the balance of the dopamine system. Finding suitable coping and emotional management techniques for you, such as relaxation training, meditation, psychological counseling, etc., can reduce anxiety and depression and promote the normal release of dopamine. In addition, good sleep quality is also an important factor in dopamine detoxification. Establishing healthy sleep habits and ensuring adequate sleep duration and quality sleep can help restore balance to the dopamine system. Remain positive and patient as you pursue your dopamine detox. Restoration of the dopamine system takes time and a comprehensive treatment approach. Working closely with a professional doctor and treatment team, following their advice and treatment plan, while paying attention to your physical and mental health, can help achieve the balance of the dopamine system and overall recovery. To sum up, dopamine is an important neurotransmitter that plays a key role in many aspects of human body function. When the dopamine system is out of balance, it can lead to a variety of health problems. Medication, psychotherapy, lifestyle adjustments, and other supportive measures can help restore balance to the dopamine system. However, dopamine detoxification is an individual process, and it is recommended to be carried out under the guidance of a professional doctor. In addition, there are some studies showing that certain natural herbs and supplements may have a positive effect on dopamine regulation. However, it is important to note that the safety and effectiveness of these supplements are still controversial, and their relationship to specific diseases has not been well established. Therefore, before considering any supplement or herbal remedy, it is best to consult a physician or professional healthcare provider to ensure it is suitable for your individual situation. In addition to medications, psychotherapy, lifestyle, and supplements, there are other ways to promote the health of your dopamine system. For example, artistic creation, music appreciation, dancing, and other stimulating activities can trigger the release of dopamine, which boosts mood and well-being. In addition, by learning new skills and challenging your mind and physical abilities, you can also stimulate the release of dopamine, which promotes growth and satisfaction. In summary, dopamine plays an important role in the human body, involving emotion regulation, motor control, reward behavior, and cognitive function. When the dopamine system is out of balance, it can lead to health problems such as mental disorders, addiction, and movement disorders. Medication, psychotherapy, lifestyle adjustments, and other supportive measures can help restore balance to the dopamine system. However, dopamine detoxification is a complex process that varies between individuals and the type of disease. Before performing a dopamine detox, it is recommended to seek the guidance and advice of a professional doctor to develop a personalized treatment plan. At the same time, paying attention to maintaining physical and mental health and maintaining a positive attitude towards life can help promote the balance of the dopamine system and overall recovery. What is your opinion on this? Welcome to leave a message to discuss with everyone. Hey, if you like our channel, please subscribe us. Haha, remember to like it.